Of all the subjects the Scottish Parliament has responsibility for, I think the public want all of the parties to work together on health above all others, simply because they recognise the enormous challenges that now face it. Probably the primary area we need to look at is primary care and an investment in GP practices. I think now we know that hospitals are under enormous strain. More people are going to A&E when they could go elsewhere if there was an alternative, and that requires us to really invest in GP primary care. One of the real challenges we now face is educating the public as to what they can expect from the health service. We know we have an ageing population. We know that because of that we are going to be having to cope with far more elderly people who suffer from dementia. We know that there is an obesity crisis which is emerging and no real means at the moment of tackling that. So we do have to get people to understand that if we are going to have a health service that is there in the need of an emergency, or near there when they have a clinical need, or there when they're feeling ill, then we all have a responsibility as well as a right to health service treatment. Well, one of the things Scottish Conservatives are committed to is having more nurses. I mean, we've taken the difficult decision that we would reintroduce a prescription charge to fund an additional 1,000 nurses. We see far, far more responsibility, ability to take decisions, to interact with patients, being delegated down to nurses. And by that I don't mean that they should simply feel they're overwhelmed with more paperwork or longer shifts or even more responsibility for which their efforts aren't recognised. I think I mean quite deliberately that if we are going to restore the whole reputation of nursing and see more people actually want to come into that as a vocation, we have to make it both a career path that is meaningful, but obviously a profession where nurses feel they are able to make a genuine and real difference for their patients. And I think the evolution of the health service going forward requires us to make that commitment and make that investment in the future of nursing.